The Mannin Line with Andy Wint.
Good afternoon. Welcome to Mannin Line today with the Department of Health and Social Care. Lawrie Hooper, MHK, the Minister, is with us, and Paul Richardson, the Chief Officer. Well, it was just over 3 years ago that there was the big split. MHK was established in April 2021 after the Sir Jonathan Michael report. So how are we 3 years on? Is MHK doing what it's supposed to do? And what exactly is the relationship between the government, if you like, the department, and the operational arm of MHK? Text, email, call and WhatsApp. You got any questions? By all means, please get in touch. Faster Mike, good afternoon. Lawrie Hooper and Paul Richardson. Hi.
Faster Mike.
Paul, so you've been here, 8 months or so, isn't it?
Yeah, I arrived at the beginning of November.
Okay. Is it what you thought it would be?
Oh, it's all that and more, apart from the weather.
Yeah.
But I was expecting that. No, it's fantastic.
Okay.
Great place.
And as the Chief Officer, are you the top of the pyramid within the department? Where do you sit?
Oh, the Minister is obviously the top of the pyramid within the department, but obviously I'm the Chief Officer, so I guess I'm the top of the administrative pyramid.
So you have to keep obviously abreast of everything on a day-to-day basis.
Yeah, I try to. I can't say I'm Leonardo da Vinci and know everything about everything, but it's my job to try and know everything that's going on. And obviously, MHK is an important relationship that we have. So I spend a lot of my time talking to Teresa Cope, who's the Chief Exec of MHK. I regularly meet her every Monday morning and we catch up on the issues of the day. So, it's a busy, full-on job.
Okay, and Lawrie Hooper, where's the synergy, if you like? What's the relationship between the Minister, the political bit, and the administrative bit, Paul Richardson?
Well, we're a pretty small department, if I'm honest. I think our FTE is around 40, and they're not all filled vacancies, they're not all filled posts. So it's pretty easy, I think, to be quite close to what's going on in the department. Quite a lot of functions. We cover the policy, the strategy, the legislation. We've got our registration and inspections team, the quality safety work that's going on. So there's a breadth of stuff we do with a very small team of people to actually get out there and deliver it. So you've got to work quite closely together. Otherwise, I think things wouldn't be able to happen.
Yeah. I mean, it bears restating the fact that, as you say, policy and strategy is DHSC, which is a small department, which then transfers to a huge budget of MHK.
Yeah, and the mandate assurance work that we do, so we're the commissioning body, so we're the guys that write the mandate and say this is what we expect the health service, what we expect MHK to deliver, and to the standard we expect them to deliver it to. So we kind of deal with both sides of that. We deal with the bit at the start that says this is what we think you should do, this is what you're required to do, and then we deal with the bit at the end that says are you doing it, and are you doing it well, and that's what the whole mandate assurance process is around. So we have a small team in the department whose entire focus is on making sure that MHK are delivering on the things that we expect them to deliver on, that Tim Ward has asked us to make sure get done.
Yeah, I mean, those 3 years, you've been there for quite a bit of those 3 years. Is it working?
I think so. I think there's been a lot of stuff that's happened since MHK has been established that I don't believe would have happened under the old structure. So there's been a lot of work around kind of workforce and culture, a lot of quality and safety improvements, a lot of kind of back office functionality stuff that, to be honest, some of us, it's Liberal Vannin, for example, have been banging on about for quite some time. Things like external inspections, for example. I don't believe that a lot of that would have happened under the old structure, and it just wasn't happening under the old structure. So I think having MHK in place has pushed a more kind of maybe more professional, more clinical focus on some of these things, which is really good from my perspective. So there's a lot of things going on now. I think we're in a much better place than we were 3 years ago. There's still a very long way to go. I'm not going to lie. It's a very long road, but I think we are substantially better now than we were 3 years ago. And I think, again, if you ask whoever's sitting in this seat in 3 years' time the same question, you should get the same answer.
Yeah. I mean, because some people have said that MHK has been, was given far too much to do in too short a space of time.
I think there's probably some truth to that, and not just Manx Care, actually, the department as well. So a lot of thought went into Manx Care when it was set up. They had a shadow board, a lot of planning went into what was going to be transferred and how, but even so, a lot of stuff got missed. There's lots of things that still haven't been finalised as to who is responsible for this and who should be responsible for it. But the department itself was almost an afterthought. Who's going to do the mandate? Who's going to sort this stuff out? Actually, we are, and we're doing it, but it's taken us a couple of years to really get up to speed on some of these things. And again, we're still not quite where we need to be as a department. So it's been a very difficult journey, actually, and I think it is fair to say that we have very high expectations of our health service, especially when Manx Care was established. I think there were some politicians especially who thought, well, it's been established now, the problems are going to resolve themselves quickly, magically everything will be okay, as if someone caught a silver bullet. But I don't think that was ever going to be the case. It was always going to be the start of a long journey. And don't forget, Manx Care was set up in 2021. There was a lot of other stuff going on.
Yes.
Back then we were in the middle of the pandemic almost, so there's been a lot of other things happening around us that have had an impact as well on our ability and on Manx Care's ability to deliver even at the pace that we originally planned.
So who owns the real estate? Who owns the bricks and mortar of the hospitals? Is that the department?
So the department still owns the whole estate. Manx Care occupy it under a licence, so they run all the day-to-day, but the fabric of the buildings, the land still legally belongs to the department, and so there's that licence agreement in place. And we make changes to that quite regularly. So the cancer centre, for example, that's being built, we've had to carve that out of the licence because now obviously the cancer centre is going to be on that land. So we do that kind of thing quite regularly with people. But yeah, it all still sits with the department. I think we were quite clear on that, and Tim were quite clear on that when the Manx Care structure was set up. We didn't want to be handing over significant amounts of valuable taxpayers' assets to an arm's length body.
Okay, there's a text in now from 696. Could you ask the Minister what's happening to Rietna Bay? When are the residents going to be moved out? This has obviously dragged on a long time as well. Some residents are getting worried and stressed, which of course is not good for them.
Yeah, so funnily enough, we were talking about that in the department this morning. Manx Care have run their procurement exercise for that in terms of how they're going to run the new Summerhill View facility. My understanding is that's quite close to being completed, and when that's finished, obviously they'll be communicated with residents as to what's going to happen. But the timescale that I think I announced in Tynwald, sort of the back end of this year, is going to be October, November time, is I think what we're still talking about in terms of transfers. But I think it's really important that I get the point across that everything's going to be done with individual patients and service users. It's not going to be a kind of an on block, this is what's right for all of you. Actually, it might not be right for everyone to transfer to some of you. They might have different options available. So really, Manx Care are going to have to work with all the people that are currently in Rietna Bay and all the staff to make sure that as this happens, it's all done properly and it's all managed well. And I've been very clear with Tynwald, I'm not telling Manx Care to put an arbitrary date on this. I want to make sure that they do what's right for those patients and right for those service users and right for those staff, rather than saying you've got to be out by the end of the... No, that's not okay. It's got to be focused on the people. That's what really matters.
Okay, and that's a big piece of real estate. What's going to happen to that afterwards?
So, like I said in Tynwald, the department still owns it. My intention would be to say, well, can we do something quickly, turn it around? It's a great building, actually. It's not suitable for what it's currently being used for, but could it be turned into, key workers' flats? Could it be turned into apartments? Could it be turned into assisted living or, care leavers accommodation? I think the answer to that question is yes, that we can do something with it. So I did talk to the Housing and Communities Board about this quite recently, and I think we're all on the same page. So really, we're now just kind of waiting for Manx Care to sort that process out where they leave the building, and as soon as it's empty, we'll be able to say, right, now we're going to do what we're doing next with it. But my plan is definitely get it developed into something, and like I say, it should really be some form of housing because it's in a really good location for that.
And obviously care home provision in Ramsey excited some comment in recent times as well. What's the situation there?
So with Commonmore, I think we're in the process of setting up some meetings now with Ramsey Northern and with the commissioners to talk about originally there was a land swap proposal, but to talk about finalising all of that stuff. And I think I'm right in saying that the proposals are currently with Treasury, and the intention will be to come forward again, probably October, November time, to Tynwald to secure funding for Commonmore to actually then start progressing with that build. So we're kind of on track with that.
Okay. Health, Paul Richardson, health and social care, obviously part of the same remit, but can you give us any indication which gives you more headaches, which occupies more of your time, health or social care?
That's a very good question, Andy. I'd like to say both or neither, but both do. I think one of the sort of exciting opportunities here on the Isle of Man is we actually have a provider that is about health and social care. When I came from England, worked there for 36 years, and Wales, they were very separate. I think one of the challenges about having separate administrations around the running of those services is that they become disjointed. On social care, I think we probably, in terms of the healthcare transformation work we've been doing, we've got quite a lot of things to consider here on the island about how we want to go forward with what sort of provision we need on the island for people, kind of care homes, home care, those sorts of things. I'd say probably the biggest headache, if it is a headache, and it's not really a headache for me personally, is how we actually drive forward some of the ambitions in the Sir Jonathan Michael report around modernising the services here on the island, providing care closer to people's homes, improving the offer that we make to the public around primary care, dentists, GPs, the things that we hear about. The Minister and I had the privilege to attend the Comyn roadshows back in April, and we heard a lot from people around dentists and GPs and access. So I think for me personally, that's one thing that we would really like to do something about.
Funny you should say that. Yeah, I've got a question in from Dennis who just said, look, effectively what's happened is that dental provision has been privatised for anybody who can afford to take out Den Plan as well. There's obviously, so anybody can afford it can go private. A lot of people can't afford to and don't, and we suffer. So, I mean, is this a problem? Is it a problem across the UK? Do they have trouble getting dentists, or is it just us?
So that's not a new thing at all, Andy. Actually, that's just the way the structure works. So the way we fund dentistry is the NHS essentially buys a number of units from dentists every year. So I will pay you to do a certain number of procedures, essentially. Yeah. That's the model that's in use across the UK. That's what we do. And essentially that's what's happened because the government has never properly funded the right amount of units. Ultimately, the dentists say, well, I'm delivering all my NHS units, but I'm not actually then getting any more money to do more NHS, so I have to take private patients. And so ultimately the system we have is a private dentistry system with some NHS kind of layered on top of it.
Right.
Whereas GPs are the other way around. We have an NHS-funded GP system, and they also do a bit of private work on top of it. And what we need to do is look to see how we can flip that model in dentistry as well, to say, how do we make sure we're providing enough dentistry for everyone? And that's to make sure, are the dentists delivering on the contracts that we currently have? Are the contracts fit for purpose? Are we buying the right amount of units? And some of the conversations are around, well, are we better off, rather than contracting a private provider, because don't forget, dentists on the island are all private firms, rather than that, are we better off actually hiring dentists ourselves? So Manx Care have taken over the Hillside practice, and actually they're running that themselves, and so we're getting to see, is that better, is that more cost effective, are we getting more value out of a Manx Care run facility than out of a private contract? And so that's a live question as well, is to say, well, if we are going to look at reforming dentistry and it is around access and it is around cost, might it be better to say, well, let's fund that from an NHS style model that says we're going to run it ourselves? And we're doing the same with GPs. We're running the GP surgery in Ballasalla as well, and it's the same question. Actually, are we better off contracting GPs, or are we better off having a more salaried model, or even a mix of the two? And actually that's kind of what we're looking at this year. Is I think you'll start seeing some shifts and some changes over the next 12 months in this space, both in terms of GPs and dentists, all with the aim of broadening access and providing a better level of service, but basically enabling more people to access the service. That's the key thing.
And do you have an interim view of whether or not it is better to have your own NHS service rather than contract in private?
So it's mixed. So my view is, I think you're better off with a kind of a hybrid solution, because sometimes you want to contract people to do things, but the advantage of having people on staff is if you want to say, like we do in Ballasalla at the moment, actually I want to run a frailty clinic down there, or I'd like you to roll out some vaccines, or whatever it is, you don't need to then negotiate around and I'll pay you for the service, because you're already employing people to do the job, you already own the building. Actually, it's no skin off anyone's nose if you start supplementing that service, and that's the whole model behind primary care at scale. It says, how can you do more stuff locally? So how can you do more of the clinics and more of the stuff that we currently do in Nobles? Could you do that via a GP practice, via a primary care hub, or whatever you want to call it?
Okay. All right, there's a message in from Lorraine and just said, what is the department's official view of the assisted dying legislation, and does Mr. Hooper have a personal one?
So I have a personal view, obviously. I support the legislation. I've been very clear on that in the House of Keys, that I've been supportive of it throughout the process. The department, on the other hand, hasn't taken a position on it, because ultimately we are, as a department, servants of Tynwald. So we're waiting to see what it is that Tynwald tells us they want us to do. Ultimately, if it is something that's mandated for us, if the law goes through and we're told you have to deliver this, then the department will deliver it, because that's what Tynwald has asked us to do. It might be that Tynwald doesn't decide to do that, and ultimately doesn't make a difference to us either way. I think
they could appoint a private provider.
There's lots of ways. I think the bill isn't prescriptive on how it should work in terms of who should provide it. So ultimately, we are in the hands of Tynwald Court on that one. And I think I've got a question on this next week, actually, in the Keys, and I'll be saying the same thing, which is if Tynwald passes a law that says you've got to do this, that becomes the law, and whatever your personal views on it, it's something we'll be required to do because that's the law. If Tynwald passes a law that says you don't have to do this, then again, we don't have to do it. So ultimately, as a department, we're in the hands of the Keys. We have looked through the bill to make sure that it's practical, i.e. will it work physically, because what I was nervous about with my ministerial hat on was a bill that went through that then the department or Max Care says physically can't do that, so there's no point putting it in the law because it's not achievable, it's not doable. Luckily, the bill, the way it's structured, all of that stuff will come later, and by later I do mean a number of years later. The detail of this will take some time to work out. We'll need to make sure we bring staff on board. You need to make sure the processes are right, the safeguards, the protections, everything. It will take a long time to actually roll out, should the bill even get through the House of Keys and the Legislative Council. So this isn't going to be something that we have to, I don't think it's something that we're going to have to be overly worrying about now. I think you're a couple of years away at least from some of those questions even being asked, let alone being answered.
Paul Richardson?
Yeah, no, I would just reiterate, as a civil servant, my raison d'etre is to be objective and impartial. So ultimately, I can have personal views about all sorts of things. Do not have a view about assisted dying as an official. If it is the fiat of Tynwald to enact legislation to make that happen, then it's the job of the department to make that work practically, which is basically a repeat of what the Minister just said.
Entirely new ground for the civil servants.
It's entirely new ground for the civil servants here on the island, I think. And I worked in the UK jurisdiction before this, and we've had various discussions and nibbles around this in terms of private members in the past. And it presents lots of policy issues that need to be worked through, and obviously we're aware of other jurisdictions that have made this happen as well. And we obviously, in terms of what we would do as a department, is we would look at the practicalities of that when it comes down to it in terms of how it would work. But at this point, we have no view.
Okay, right. Call 66 13 68. Text, email, and WhatsApp. And Julian's first with us today. Hi, Julian. You're live with Lawrie Hooper and Paul Richardson.
Hi, Andy, and hello to Lawrie and Paul.
Hi, Julian.
Hi.
Hiya. I've got two questions, so I'll go quick. First one concerns assisted dying, so the text before is pertinent. Lawrie, considering the current problems with funding the health service and hospice, at the last government conference that I attended at the Villa Marina, you stated that you don't think the assisted dying bill in its present form goes far enough. What do you mean exactly by far enough? And if the current assisted dying bill went through, would you seek to amend it in the future? And by the way, are you concerned at the possibility of a large percentage of doctors leaving the island based on their Hippocratic oath against assisted dying?
So my personal view, I think I've expressed a number of times about the assisted dying bill, and I said this in the House of Keys. The bill is very narrow in its scope. It deals explicitly with terminal illness. There are bills elsewhere in the world that deal with unbearable suffering, and I think from my perspective that's probably what I would land personally. So that's what I was referring to in the conference when I talked about what my view personally is. But again, as I told the House of Keys quite explicitly, I have no intention of trying to amend this bill. Not in that scope, and the reason for that's very straightforward. Actually, is we've I think reached a space where we've got something that is workable, that I think I'm comfortable with in terms of being able to put the right safeguards in place. What you've seen elsewhere in the world is where you have a very narrowly drawn bill, very narrow scope. That scope doesn't then change, hasn't subsequently changed. Where you've got jurisdictions that have started with a broader brush, you have then seen in some places that kind of scope creep, I think you might call it. And I'm not comfortable with that at all. I think if you're going to make changes, it has to be very much upfront through the parliamentary process. So now my view on it is I wouldn't be seeking to amend this bill. It is what it is. I would much rather say, if it is the will of the House of Keys, if it is the will of Tynwald that we do this, we do it and we do it right, rather than spending all of our energy constantly trying to tweak and amend and change things. If they've made a decision, that's what we'll follow with. In terms of staffing, I'm actually really concerned, if I'm honest, about staffing levels. So one of the amendments that I have brought brought to the bill, which is an amendment that has been supported by the BMA, is to make sure that we strengthen the conscientious objection clauses, but also have an opt-in provision. So staff would have to make a positive decision to opt in, because otherwise, that there is that concern that staff might feel pressured, or they might feel that they don't have a choice in terms of this. And I want to make sure it's absolutely explicit that unless they have opted into supporting a service, that they will never be asked to participate in it. And that's an amendment that I have brought to the bill, because it is something that does concern me, actually, about making sure we make sure that staff we have are supported in making sure they can exercise their rights and their ability to object to things that they conscientiously don't agree with.
Julian?
Yeah, I do remember also at that particular meeting, you also said that Tynwald can do anything we want. So I would imagine a future Tynwald would be able to overturn it. And, as you said, you'd like to have a wider scope, which from my perspective is exactly what the slippery slope is. I'll get straight on to my second question, Lawrie. It does involve the health service. The Bishop's vote, I'm interested to know why, despite a majority vote in Tynwald last year, not to remove the Bishop's vote, especially when you consider that Legco's unanimous 8-0 again, you're still pursuing this. And this coming Tuesday, you are seeking to forward a motion in Legco to amend the name of your bill to the Constitution Bishop's Vote Act of 2024. Is this a justification and a solidification for the overturning of that vote last year? And also, is this the best use of government resources pursuing getting rid of the Bishop's vote, when there are other far more pressing issues like problems with the health service, the hospice, not to mention air traffic control, the ferry terminal?
I'm not in the Legislative Council. I have no control over what they do. If they want to change the name of the bill, that's up to them. I've no interest in that at all, actually. I took the bill through the Keys because actually it was the will of the Keys. As you know, in that Tynwald vote, the House of Keys said we should do this. So this is why I did it. I've been very clear about that. But the reality is, if Legco want to change the name of it, they can do that. It's entirely up to them. They're a separate branch. It's really in their hands. And also, this isn't a government function. So to be clear, this is a parliamentary matter, not a government matter. And they're very different things. So in terms of government resources being expended, I'm not aware of any government resources being expended on this bill. It is purely a parliamentary matter. I would say, though, that I've been very clear from the outset. It's a very simple bill. You support it or don't. But actually, people opposing the bill have been dragging this out. It took so long to get it to the House of Keys because we had the same debate, I think, 8 times. And it was, if you go through the Hansards, almost verbatim, the same debate again and again and again. It wasn't me taking up parliamentary time with this. I was quite clear with people saying, look, if you don't support it, just vote against it. We'll crack on. Let's not debate this again and again and again. It's a relatively simple question. So I'm only spending time on it now because people keep asking me about it. Ultimately, it's gone through the House of Keys. It's in the Legislative Council. It's in their hands. Okay,
all right.
But, I'm just going to say, as long as you're not concentrating on the Bishop's vote instead of the bottomless money pit of the health service taking huge amounts of funding.
I can assure you, Julian, that I have spent a very minimal amount of time on that. In fact, I spent more time talking to people on the radio about the bill than I have actually on the bill itself. It's very distinct.
Okay, all right. Thanks, Julian.
Thanks very much. Cheers.
Okay, good to hear from you. And here's one. This is 696 who just says, what's happening before the pandemic, we were told there was going to be a private provider. The private ward at Nobles was going to be back. And still to this day, nothing has happened. What's happening? Is it Manx Care's function or DHSC?
So it's a Manx Care function. The department doesn't provide any services. We commission them through Manx Care. So Manx Care do have in their mandate the objective of getting the PPU back up and running. And I know they're quite keen to do that, actually, not only as an income generator for them, but also to make sure we have a private service on the island that's available for people. They are currently, though, utilising the private wing, or they have been, I should say, rolling out what we call the Restoration and Recovery Initiative. So that was an NHS initiative to treat people. We treated just over 3,000 people with surgical interventions. As part of that, I gave a report to Tynwald on Tuesday. It was a phenomenal success in my book, and actually the staff involved throughout that have been brilliant, all the way through. The administrators, the Manx Care staff, the Synaptic staff, it's been great. The feedback we've been positive, been brilliant. So we have been utilising the space. It hasn't just sat there empty. Yeah. But it is inside Manx Care's list of things we'd like them to get done, is to get that PPU back up and running.
Well, you would have thought if it's a profit generator, why wouldn't they get to it?
Absolutely. So I think the problem we've had in the past was we weren't sure if it was making a profit because, again, it comes down to poor data and poor information and all that kind of stuff. So the question for Manx Care is, how can you run this at a profit? And of course you can. Private units work all over the place and they do make money. So the reality is this a service that Manx Care can offer to people on the island as a supplement, really? And the answer to that is, I think it is. Manx Care, I think, are quite keen to get it up and running. So fingers crossed, we'll see progress on that in the next 12 months.
OK, and here's a message from Ian, who just says, regarding we talked about the Synaptic provision as well, and his view of us is, surely if we paid all this money to bring in an outside contractor, isn't that just privatisation?
No, so privatisation would be charging you for the service. That's what happens. No, what we've done is we've made sure that people are still NHS patients. They're treated in accordance with the NHS clinical guidelines and all the rest of it. Our consultants were obviously involved, our staff, our facilities. The reason we brought their team here, and we had this question in Tynwald from Mr. Thomas, why didn't we just send people over to the UK? Part of the rationale for doing it on island was to make sure that we could embed better practice. So we've learned stuff from bringing Synaptic in. So what we're now seeing on the island is a better orthopaedics pathways, better ophthalmology pathways, people being discharged quicker. I think the discharge time now is an average of 1.5 days instead of 3.5 days. So people are spending less time in hospital after surgery. So all that stuff that we benefited from, that is all now benefiting NHS patients. So if you've had your cataracts done in the last 12 months, you will have had a better experience than you would have done 2 years ago because of all the stuff we learned from R&R. The same goes for your orthopaedics work, same goes for your general surgery, all the stuff that we've funded. It's embedded, it's helped embed better practice, better learning throughout the system. So this was all about tackling some waiting lists, dealing with some people that have been on those for quite some time, but also making sure that everyone else that goes through the system now gets a better treatment. Even though we've stopped paying Synaptic to do that work, even though you're now back in your standard kind of NHS model, you should be getting a better experience as a result of the stuff that we've done. So it very much isn't privatisation. It was about bringing people in to help them, to help us, but actually to solve a very particular problem. So, and to my mind, it's been a great success.
I was going to say, if there's any criticism, we normally hear about it on Mannin Line, and there's been very little criticism of Synaptic. It's been almost an unmitigated success.
Yeah, it's one of the very few things I think that has worked almost exactly as we would like it to have worked. It didn't quite deliver all the procedures we wanted, but it did come in on budget, and that was critical, I think, for Tynwald and for us. And it has achieved, the sustainable positions that we were hoping for, the sustainable waiting lists. So we're just hoping now that means they are genuinely sustainable. So as a department, we're monitoring that to make sure that when Manx Care are telling us it's sustainable, that it really is.
So is there any provision for Synaptic coming back? Was there a trigger point in the future?
So we are in the process of working up a business case for what we call phase 3, which will be the final phase. As I mentioned, we did 3 specialties with phase 2. This would cover basically all your other specialties plus a big chunk of outpatient work. So what we're hoping to do now is take that through the Treasury process. So we are, I want to say, negotiating with Treasury. That's probably the right way of describing it, around what that looks like, around taking something through them and then through the Council of Ministers to hopefully bring something to Tynwald towards the back end of the year. But we've got a few hurdles to get through yet in terms of getting those approvals signed off. So we are working on that. And if it's at all possible, we will be bringing something forward to try and deal with some of the other backlogs and waiting lists that we have. OK,
Lawrie Hooper, MHK, the Health and Social Care Minister, is here with Paul Richardson, the Chief Officer. We're on Mannin Line today till 1. On Monday, Claire Barber, MHK, and Scott Gallagher, DEFA Minister and Chief Exec, will be on. Any questions regarding DEFA's remit, by all means, do get in charge. And back in a moment with Lawrie and Paul.
Hi, it's Connor Cummins here. I'd just like to wish Manx Radio a very happy 60th birthday.
Caring for a loved one with special needs can be overwhelming.
With my mobility issues, I find it difficult to manage.
This is when Top Care Nursing can help. Proud to be an Isle of Man Award for Excellence winner, their friendly, professional team of carers and nurses offer a wide range of home care services. From help with daily tasks to giving round-the-clock care, Top Care Nursing can even take blood tests in the home. For a free consultation, call 628 919 or visit topcarenursing.im.
Hello, I'd like to rent a car for 3 days. Just something reasonable.
No problem at all. We've just a few rules. You can't go off island, you can't smile in the car, you can't take any friends. Oh, and it's £10,000 a day.
Renting a car doesn't need to be difficult or expensive. With prices from just £50 per day and now collection and drop-off at the airport and Douglas, speak to Rex Rental Company or book online at rexrental.im.
Rex Rentals. I'm so glad to hear that.
Summer, a time for blue skies and sunshine. With Skipton International, you can turn up the heat even more with some amazing interest rates. Guernsey's Bank Skipton International offers a range of savings accounts, from fixed term to notice and easy access, enabling your savings to shine brightly. So what are you waiting for? Make your summer great by switching to Skipton International today.
For details of all Skipton International savings products, call 01481 730 730 or visit skiptoninternational.com. Skipton International is licensed to take deposits by the GFSC and is a participant in the Guernsey Banking Deposit Compensation Scheme. See dcs.gg.
Garth MHK Daphne Kane has certainly not been short of challenges since she took up the reins at the Department of Education. Do you save $3.5 million a year by closing primary schools, or acknowledge that the backlash from those affected will be too big a political price to pay for a government which struggles to find popularity? As ever in politics, there's always much more to these decisions than the pithy headline, as Mrs. Kane explains on Perspective on Sunday at 12 noon on Manx Radio with me, Phil Gaughan. The Chief Minister told Tynwald he's looking for efficiencies across government. So is the school closure rejection an opportunity missed?
The Mannin Line with Andy Wint.
Mastermind, 24 minutes before 1 on Manx Radio. And what's happening to the HSCC, Lawrie Hooper? Can we have an update? This is Charlie wants an update on the HSCC.
You absolutely can. So Paul has just signed off the appointment letters for the new members today. So
HSCC, for the uninitiated,
so it's the Health Services Consultative Committee. So in the NHS Act, we're required to have a committee that we consult with, and it's supposed to be full of lay members, essentially. So we went through a process of reform last year where we added some requirements on terms of some clinical background on there, but also to make sure that they were focused on patients rather than on policy, because ultimately, as a committee, what their remit really is to provide the department with information and advice on services. And so we were keen to say, great, tell us about the services from your perspective, from the patient's perspective. So we went through a process of appointment. I think we had 20-something applicants in the end for the 6 posts that we had. So it was great. I wasn't involved in the appointment process myself. I hasten to add, we had a member of the HSCC on the panel, along with a member of the department and someone from HR, I believe. So that all went through, and Paul's now signed off the appointment letters for the 6 appointees. So I'm hoping that we'll be in the process of setting up their first kind of induction and training and meetings, and then I'll get to meet them all in the next couple of weeks and get to have a chat with them and find out where they want to focus and what they want to look at first.
And how do the members interact? What do they do, Paul?
Well, I mean, they're actually a body of the department. I mean, their job essentially is to help us get a different perspective on the services that are being offered to the public of the Isle of Man in terms of health and social care. So, I'm expecting them, and we'll talk to them when it comes down to it. I'm expecting them to sort of get underneath some of the things that are going on, and talk to us about the experience people are having of the services they receive, and that in itself will help us inform the policies that we develop as a department. So it's going to be a great relationship. It's a little bit like a model that exists elsewhere around the islands around us in terms of different bodies, and because they are lay members, they will have a completely different perspective. So we expect them to be very, very closely involved with the department. I'm really looking forward to working with them. As the Minister said, we're going to induct them in a couple of weeks, and then they will form their committee, elect a chair from among their number, and we're good to go for the year.
Okay, a couple of questions about treatments now. I'm a heart failure patient with an ejection fraction of 20%. My cardiologist tells me the drug of choice for my condition is Entresto, but he can't prescribe it as the government won't fund it. I'd like to know, are there any plans to make this drug available on the Isle of Man? It's used worldwide for this condition. And at the side of that, a text to 044 says, I went to the doctors last Monday and asked for the weight loss injection and was told it's not on on the Isle of Man. I can't be the only person that needs help, so why haven't we got it? So who approves treatments, Lawrie Hooper?
So this is one of the interesting things that I talked about before that wasn't really considered when we split the department and Manx Care. Strictly speaking, the department is still the person that approves, the formulary, the drugs, which doesn't sit quite right with me, if I'm honest. I think there's got to be more input from Manx Care on that. I can't speak specifically about specific drugs because I'm not a clinician, obviously, and we don't go to that level. But my understanding around Entresto is it's a NICE TA. So what that means, it's something we call a NICE technology appraisal. So it's in the UK, the NHS is required to provide drugs that have been approved in this manner by NICE. We don't have the same statutory requirement here. We have, however, instructed Manx Care. We expect that you would offer NICE TAs the same way as they do in the UK. So a patient on the island should get the same level of treatment as they would in the UK in terms of these drugs. The challenge there is that sometimes these drugs are more expensive, so they can provide much better outcomes sometimes, but they can be more expensive. And sometimes they can be more expensive in the short term but save money in the long term. So ultimately it all comes down to which ones can we roll out and how can we afford to do it. So the instruction we've given Manx Care this year, because we have been going back and forth over this for quite a few years now, trying to get these TAs rolled out on the island. And it always comes back down to, well, only if you fund it, only if you give us extra money, and that's really difficult in the current climate because there is no extra money to kind of hand over to the health service on top of what they're already getting. So what we've agreed with Manx Care is they will roll out the NICE TAs, starting with the ones which can be done on a cost-neutral basis or ones that will save money, because some of them actually do save money. You know, if we can get new drugs, it's more effective, it's cheaper treatment, all the rest of it. So that's the instruction we've given Manx Care. So what they're in the process of doing now is working out what that looks like and how they start rolling those out. So if people have questions about, actually, I've got a particular drug that I'm expecting to be on that list, my advice would be to give MCALs a call and make them aware that you're interested, and I'm hoping Manx Care will be keeping a record of this so they can keep people informed as to whereabouts things are. I would like to think that when they've got their rollout plan, they'll be informing their consultants as to what that looks like, and so consultants will be able to tell patients roughly where things might sit in a level of priority.
OK, Betty's with us now, so let's get to... Hi, Betty, you're live with Lawrie Hooper and Paul Richardson.
Oh, hi. I just have to say that my late husband was a doctor, and he never had to take a Hippocratic oath. He told me that.
Are you sure he was a proper doctor?
Oh, yes. He was a proper doctor. He actually worked here in the Isle of Man at Ballamona, and he worked in Canada, and he worked in Bermuda. Because we went through all those places, and he was definitely qualified.
All right, Paul Richardson?
No. Thanks for that, Betty. The Hippocratic Oath is a concept more than anything else, and you probably realise that to practice as a doctor on the Isle of Man, you have to be registered with the General Medical Council, otherwise you can't practice. That's a UK body, but it extends to the Isle of Man, and that's all that we require. And the GMC sets out the standards and coded conduct for doctors, so you're quite right about that. The Hippocratic Oath is kind of old-fashioned term for what is actually a fairly tight system of professional regulation.
So it's just a notional thing, the Hippocratic. Oh, I didn't know that. Well, we've learned something today, Betty.
And one other thing, my daughter is a psychologist, and she works in Victoria, Canada, and she said that the change to allow mental patients or disabled people to... She's worked on this. Hasn't come about yet. The bill hasn't gone forward yet to allow those things to happen in Canada.
OK, all right, thanks. All right, Betty, it's good to hear from you today. Thanks for being with us.
OK, thank you.
OK, just a quick word, by the way. As it's Friday, it's our 60th anniversary, so after Mannin Line today, we're back in 1968 with Peter Neal. Peter Neal, again, I was talking to Ina Sharples the other day, but Peter Neal will be commentating on the 1968 FA Cup final between Pulrose United and Old Boys. That's after Mannin Line finishes today. Adult care provision on the Isle of Man. There's a message in from Dave, who just says, what did you think of Julie Edge's speech the other day, Lawrie Hooper?
So actually, I happen to agree with a lot of what Julie was saying. So I've been very clear, even from if you look back at my manifesto, around things in social care, that the system we have where the people are required to be financially assessed before you can sometimes get support. The amount of support you get can depend on whether you're in a care home or not, and actually there are lots of people out there who are unable to get the support they need from the state. And this leads me into the carer strategy that we took through Tynwald this week, again trying to support people who are providing this unpaid carer role for people, largely because actually the state isn't there to support people. So we actually launched a consultation on the best model for providing this sort of care for people. That consultation closed earlier this year. We're looking to be able to bring forward, I think the results of that should be coming out relatively soon. I don't know when, unfortunately, but we'll be bringing those results out, and then I'll be coming back to Tynwald really saying, look, we've consulted, the Manx public have given us their views on which of these better options are available. Is it going to be a mixed model like we have in Jersey? Is it going to be an NHS style personal care model like they have in Scotland? And if the answer to either of those is yes, we'll have to find a way of determining how we pay for it, because that's going to be the big question. Because if we move away from a system that says you've basically got to pay for it yourself unless you're a very small cohort of people, to one that says the state will pay more, well, the state can only get its money from taxation. Somebody has to pay.
Well, there's a time bomb coming down the path, isn't there? Because the population is getting older. We need, I mean, is it true that we need a new care home every year?
So I don't think that's the case, especially because what we're looking to do is move to more of a care at home model, because there's lots of evidence that says keeping people in their home longer is better for them, it's more cost effective, and actually not everybody wants to go into a care home. So providing choice, I think, is what I'm quite keen on. But yes, I think you're right that this is a problem that's going to keep growing as more and more people need some sort of care, as we have more people then providing that care. We are at a tipping point almost, and we have to make a decision on what the future of this system looks like. So I think Miss Edge was, I think she veered off the carer strategy a little bit and support for carers, but her points that she was making about the care system and how we absolutely need to reform the way we deal with social care, the way we fund it, the way we access it. I think she's absolutely right, and I had a quick chat with her after the sitting, and I think both of us are very much on the same page that says this reform that we're bringing forward following this consultation is long overdue.
Okay. Hi, Ken. You're live with Lawrie Hooper and Paul Richardson.
Afternoon, gentlemen. How much has Manx Care saved the Manx taxpayers, and can you quantify where the biggest saving has occurred, and does the department or Manx Care have any recent involvement in the Corrin home in Peel, which is lying empty?
So I'll take those in reverse order. The Corrin home was a private care home, nothing to do with the department, nothing to do with Manx Care, never has been. We did, however, meet with the trustees because we talked around, after they just made the decision to close the home, what the future of that site might look like. So, in fact, at the government roadshows that we did when we went around the island, I happened to bump into some of the trustees when I was out in Peel, and we had a bit of a chat. So I've got a meeting scheduled with them, I think, towards the back end of the year to talk about what the future of the site looks like. But ultimately, it's a privately owned site. It really isn't anything to do with the government. It never has been anything to do with the government. So I think, to be fair, I think that is a bit of an issue because we don't have a kind of a government state care facility in the West. Maybe we should have one. That's a big conversation which I think we need to have. In terms of savings, we can quantify the financial savings actually. So as part of the budget process, Manx Care have been required to prepare what's called a cost improvement programme. So every year we've told them you must save X% of your budget. Every year they've exceeded what we've asked them to save. So in year one, I think we asked them to save 4 million and they ended up with a 6 million return. Last year it was 11 million. The target for this year is 18 million. So actually they really are returning savings to the taxpayer out of what they're doing, and all that stuff is reported publicly. If you look at their public board minutes, they publish all their financials. You can see the returns on their cost improvement programme. It's all available on the website, and it's something we as the department keep a very close eye on because obviously the budgetary control is something that has been a big concern around the health service for a long time, and it is a particular focus of us this year to make sure that Manx Care are doing everything they can to come in on budget. But yes, the savings that they are generating, some are cash savings, some are efficiency savings, but it is all quantifiable, and it's all publicly available information.
Off the top of your head, any idea how much?
So the amounts, I said, it was about 6 million in year one, about 11 in year two, and 18 is what we're looking at this year. Okay. I can't tell you off the top of my head where the biggest area of saving has been within all of that. It's not something that I know there is a big saving in terms of agency and bank costs because they've had a lot of success in recruiting people, and I think that runs to a couple of million, but I couldn't put hand on heart say that's definitely the biggest area.
Okay, all right, thanks, Ken.
Cheers, thank you.
Cheers. Now it's 11 minutes before 1.
It's the Manx Telecom Parish Walk this Saturday. Whether you're walking, watching or driving, remember the roads will be extra busy, so take extra care. For details of road closures and to follow your friends and family, visit parishwalk.com.
Customer satisfaction and quality have been a priority at Milcreasts for over 60 years. We're proud to represent the great car manufacturers, Jaguar, Land Rover, Vauxhall, Mitsubishi, Subaru and Isuzu, and have taken time to build up the trust and respect of both car makers and drivers. 100% independent and Manx owned for new and approved used cars, leasing, servicing, parts and superb customer service. Milcreasts. It's what's behind us that keeps us in front.
If you're job seeking in finance and accountancy, trust and corporate service or wealth management, then contact the specialists, Orchard Recruitment. We'd like to hear from you if you're a fully qualified professional in your sector with 3 or more years' experience. In return, Orchard Recruitment will introduce you to a wide range of fabulous career opportunities. Your dream job awaits you at orchardrecruitment.com. Orchard Recruitment, a refreshing change.
Housing, benefits or employment issues, faulty goods, bad workmanship, financial problems and relationship breakdowns. We all run into difficulties in life and it can feel like there's no one who can help you sort them out. But at Manx Citizens Advice Service, we can help. As an independent charity, we offer free, confidential support covering all sorts of areas. You don't need an appointment. Just call in at Promenade Church, Loch Promenade, Douglas, or call 366 338. Open Tuesdays from 12:30 till 3 and Fridays 10 till 12:30. Manx Citizens Advice Service. Your advice service.
With Andy Wint.
Faster Mai, good afternoon, 9 minutes before 1. What's happening to the promised adult ADHD pathway on the Isle of Man? This month alone, I've had to pay out nearly £300 on private prescriptions and check-ins with a private provider, which is crippling the family financially as well as many other families as well. When can we expect to have a recognised pathway on the Isle of Man that will actually help those of us with somebody with this debilitating neurological condition? Lawrie Hooper.
So that's a really good question. So the focus of the department for a long time has been on the children's pathways. So we've secured funding for things like CAMS to try and sort out waiting lists around that. But we are aware that isn't obviously going to help people that are currently suffering from ADHD and who are adults and aren't going to get to see the benefit of that. So we've been working with Manx Care on what's called a shared care arrangement. And I'm aware that Manx Care are looking at a programme whereby if you're already on a prescription, you'll be able to have that kind of transferred onto the NHS. So it'll stop being a private prescription onto an NHS prescription. I think you'll probably still have to pay for your kind of annual check-ins with your consultant or whatever it is, but ultimately the prescriptions should move on to that GP shared care pathway. I don't know off the top of my head where that's up to, but if your caller wants to drop me an email, my email address is on the website. I will definitely find out that information and get it back to you.
Okay. Paul Richardson, who is the Chief Officer of the Department of Health and Social Care. So, Paul, just, in the 8 months you've been here, a quick overview of what you think of the organisation, and have you spotted any paths forward?
Yeah, someone asked me the other day, one of my old colleagues in London, what it was like working on the Isle of Man Health and Social Care. I've worked in health and social care for 37 years, so it's my life, it's my career. The Isle of Man, it's a small place. For me, it's actually a pretty tough job. The Minister's sort of touched on that. There are things that we'd like to do here, but we have budgetary constraints here, which, because we are small, we have to manage our budget pretty well. And there are things that we'd like to do here that we see other people doing, and we think, well, how can we do that here? It's a real challenge to make that happen. But I think the strength of it all is the ability to come and do things like this and talk to real people, meet real people. You're that much closer to the community. I was a very remote, faceless bureaucrat when I worked in London, and here you can't be a remote faceless bureaucrat. You have to engage with people. So on the whole, I've enjoyed it. I think it was a difficult winter to get through with all the weather we had, but I'm looking forward to I've moved here, so I live here now, so I'm looking forward to sort of taking this forward and trying to make it work. We've got some new people coming on stream. We have a new chair for Manx Care, Professor Wendy Reid. She's just started. and it's exciting to work with people like that and try and move us ahead.
Okay, and Lawrie Hooper, obviously demand is never going to go down. That's one department that you will never be short of customers. So in terms of finance, very briefly if you would, are the numbers stacking up at the moment?
So it's a difficult question to answer. We did get a significant uplift this year from the Treasury, which was pretty much what we asked for from the Treasury, so that was good news. The challenge, of course, is demand often outstrips your ability to meet it. And this is really the whole principle behind Sir Jonathan's report, was to say you need to invest in stuff now, because if you don't, that demand is going to become uncontrollable. So I would like to think that we're in a space where we are able to manage some of that demand, and the work we've done around things like restoration and recovery is evidence of things you can do, but you have to be willing to invest in it, and that's the trick. If you just expect Manx Care to deliver miracles, they're not going to be able to do that. But if you're willing to say we are willing to invest in these things now, you can help manage that demand going forward, and ultimately it's cheaper in the long run.
Thanks for being with us today. Good to hear from you.
WINT. 60 years serving you as the nation's station. This is Manx Radio.
Sport has always been an important area of Manx Radio's broadcasting over the 60 years. Here, let me waft you back to 1968 and the FA Cup final. Louise Quirk.
Soccer is the sportsman's game, and here's the current action.
It's now time to go over to Peter Neal up at Onken Stadium, who's reporting on today's FA Cup final.
Thank you, Louise, and a very good afternoon indeed from a sun-drenched Onken Stadium, where we're just about 12 minutes away from the start of the 1968 Isle of Man FA Cup final. In fact, it's a repeat of last year. You may remember that these two teams, Polrose United and Old Boys, met in the Isle of Man FA Cup final last year, when Old Boys won the cup for the third year in succession, coming out on top by 3-1. Old Boys this afternoon are chasing this cup for the fourth time in succession. Polrose United, who have already won the First Division Championship, are chasing the Isle of Man FA Cup for the first time in the club's history. Old Boys success over the past 3 seasons has been built on a solid defence and the ability to break quickly and counter-attack. Polrose United, well, a Polrose versus Old Boys match is always a safe bet for good class football with very little in it. Polrose have got the reputation of playing attractive, attacking football, but give nothing away defensively, as their league record this year would suggest. 103 goals scored, 15 against in their 20 league matches. The half-back line is probably the strongest point of the side, but the main danger comes from the left-wing pair.
Peter Gilbertson chasing through now, and it's Quine coming out, but and what a miss, but it's picked off the line, and that was a lucky let-off there. Peter Gilbertson couldn't get a hold of it. Eric Quine missed it. Another shot was chased through, and it looked like Arthur Hull's along the line, clearing the ball for Polrose United. Well, that was a chance there. It could have been a goal at either end. Stayed with Peter Gilbertson, arm round him, checking he's okay now. Peter Gilbertson on his feet. The ball is on the far left. Switched across now to Eddie Convery. Eddie Convery breaking in. This could be the last move. It's a dangerous one lobbed in. Frankie Cannell's going for it. Frankie Cannell, but he's beaten there, and Prentice picks the ball up and kicks clear. And there is the final whistle. There's the final whistle. The score: Douglas High School Old Boys 3, Polrose United 2. But what a grandstand finish that really was. An exciting game from start to finish.
Part of island life for 60 years. This is